Live. Welcome, welcome, welcome. We're going live. We are here at Perspectives in Primary Care, and this is yours truly, Dr. Carol Penn, enjoying being with my colleagues, Dr. Kadisha and Dr. Deitrick Gorman. Now, we've been having some technical difficulties tonight, but we are just going to go ahead. And tonight's topic is mental health. And we wanted to talk to you and bring some information to you because all of us are out here #working on the front lines, and we have been seeing the impact of this coronavirus and pandemic, not only on the physical health of our patients, but on the mental health of our patients. So tonight I'm going to talk to you for a few minutes about what you could do on the home front. Then I'm going to turn it over to my colleague, Dr. Deitrick, and then Dr. Deitrick's going to pass it on down to Dr. Kadisha. So I'm Dr. Carol Penn, working out on the front lines in family medicine and primary care. The resource that I'm going to share with you tonight, and I'm going to invite you to look this up yourself because they have lots of great information on this website, is the National Alliance on Mental Illness, or NAMI, N-A-M-I, National Alliance on Mental Illness. So one of the things that I've been hearing in my office is, complaints about these feelings of anxiety, complaints about things not being quite right, worries, if you will. So according to the Kaiser Family Foundation poll, they found that the top worries during this coronavirus pandemic are as follows. Everyone is worried about, myself or a loved one or someone in my family getting sick. Mm-hmm. Number 2, investments such as retirement or college savings will be negatively impacted. Number 3, losing income due to a workplace closure or reduced hours. Number 4, not being able to afford testing or treatment if you need it. Number 5, you will put yourself at risk of exposure to the virus because you can't afford to stay home and miss work. And all that on top of just regular life kind of adds up to, it does stress you out. It does make you worry. And then on top of this, we have those that are working out there on the front lines, and they're worried about, oh my goodness, my duty to serve, and I'm called to do this, yet is it going to be at the sake or the expense of my family and my loved ones? So a couple of things that you can do in your home every morning. You want to have a reset routine, a reset button. So whether you get up and you pray together or you meditate together, that's something that I'm working with my broader community every morning. I'm doing meditations on Facebook Live. You'll find out more about that later. But just resetting the mindset. It is very important that you're also mindful of your news consumption. Look, this stuff is on 24/7, and you could just overdo it, and you don't want to overdo it. Decide you're going to get 10 minutes to, hear whatever the latest update is, and you're also going to limit your sources. Are you going to listen to 5 or 6 stations? No. Maybe you're going to listen a little bit on the radio, NPR. Maybe you're going to listen to a little bit of CNN, and then maybe you're going to look 5 minutes at a local news station so you can have the both perspectives, what's happening locally and then what's happening globally. And the two can be very, very different. So, enough is enough. You also want to practice acceptance. Hey, folks, this is what's happening right now. You are working from home. Maybe your work has downsized. You're not working at all. Maybe you're homeschooling children. As my friend Dr. Bonnie said, that's just not my ministry. But anyway, maybe you are charged with doing that nonetheless. Practice acceptance. We need to practice acceptance of these things. You also want to be able to ask for help when you need it, and also give help. There is nothing that makes us feel more in control and can uplift mood and can help shift the energy around than when you think about somebody else and you help somebody. So maybe there is an elderly neighbor, maybe there is a relative, and help can come in all forms. Help can just be in thinking of the person and picking up the phone and just saying hello, I'm thinking about you. So you alleviate someone's sense of loneliness or isolation. You want to make a health disruption plan. So, and this is, educating yourself. So find out, look up some information about anxiety and stress and know about what are some of the preventive measures for preventing you from getting coronavirus. And if you get coronavirus, how you can take care of yourself or a loved one at home. So sometimes, information is power. And then I'm going to wrap up my information and my sharing tonight with two quick stories, something that my husband and I implemented in our home that has been very, very helpful to us. One of the things that they recommend on NAMI is that you get involved with a project, right? All of our timelines have been changed around and different. So one project we got involved in, we're now like on day 86, we decided to revamp our entire approach to eating. Both of us are living and dealing with some chronic issues, and we thought we had a pretty good diet before, but we said, hey, why not? We have time to really look at the science of this, to really kind of study this, to take the deeper dive. So we did, and we did it together. So every morning, instead of getting up and just jumping into whatever the latest catastrophic perspective is on the news, we get into what it is that we're eating. We're looking at some informational and educational videos. So we're really studying, and we've had some great results. I've had some incredible results in terms of what I was going for. My husband had some weight that he was losing. He's lost the weight. He's met his goal, and it's just given us this great point of reference. So long-term project, and we decided to revamp eating. We had to do that anyway, right? With all the recommendations around shopping. So why not just do a whole, 360? And then we also built a garden. So we really got into designing the garden, choosing the vegetables that we were going to put in the garden. Today we actually planted the garden. And it's just been so delightful and fun. We have beautiful hanging baskets of flowers that are on the post that are in the enclosure, surrounding the enclosure of the garden. We have wind chimes out there. And today I just looked at it and I said, I feel like it's my cathedral. It's so beautiful. And to see, this new life, growing in our yard. Well, before COVID-19, we were both so busy, didn't have any time for a garden. What? Are you kidding me? So again, this is a golden nugget. And there's so many golden nuggets that you could do right there in your home. Don't have a yard, grow a little herbal garden, an indoor herbal garden, or have a little window box garden. Lots of tips, lots of great ideas. Go visit the NAMI website and you'll get lots more. So Dr. Deitrick, can you take us into what we could do in the home environment?
Certainly. Thank you very much, Dr. Carol. And for those who don't know me, I'm Dr. Deitrick. I just wanted to see if Dr. Kadisha wanted to see if anyone has checked in, if they had any comments first.
Okay, so everyone is saying hello. So hi, Victoria. Hi, Dr. Erica. Hey, Emmanuel. Hey, Dr. Ken. Thanks for coming in. And folks, if you are in, I see we have maybe 10 or 11 people. If you could just make yourself known in the chat, ask any questions, express any concerns, we greatly appreciate it. Take it away, Dr. Deitrick.
Wonderful. So, yes, I'm Dr. Deitrick. I'm going to be talking about mental health in the work setting. Some of the information I took was actually from workplacementalhealth.org. A lot of the stuff is coming from me, but I just wanted to put that extra resource out there if you're interested. Okay. So some of y'all may be still working at home and feeling some kind of way about it. Some of you all never left work, like the essential workers, and so you're still at work. And then there's some who are at home and they're getting ready to transition back into the work setting. And so unless there's like the ideal situation where you know you're going back to work and everybody that's going back to work has been tested, where you know how your coworkers are, this could definitely lead to some stress and anxiety, right? Some people may be happy to go to work, but again, others may be very nervous about it because they don't know the exact situation that's going on. And as you all know, people are getting tested, but everybody isn't getting tested. So that can lead to definitely some anxiety. I wanted to actually just give you all some suggestions on managing your overall mental health when you're at work during this COVID-19 crisis and actually beyond. So if you're at a physical environment or actually if you're working at home, I just want you to be aware that there's definitely uh, uh, stress and anxiety that's going along with it, okay? I just want to say, though, if you do have any actual mental health or psychiatric diagnosis, I would encourage you to please, please, please stay on your medications. You'll take your medications as directed by your healthcare professional, your psychiatrist. Continue your regular treatment regimes. Keep up with your appointments. Um, just please do it. If you feel that you need that extra help, telemedicine is really big right now, so you can schedule some extra appointments, but please stay on your regime, okay? So as some of you are in the work setting, there's some suggestions I want to have or want to provide to you with concerning your stress and anxiety and actually help you improve your mental health, your outlook, okay? And these suggestions are for you if you're working in the home setting or in the actual physical setting where you actually have to go back to work. So the first thing is I actually want you to take advantage of any workshops, seminars, webinars, classes, trainings that your employer might offer. If there's any actual employee assistant benefit programs that can help you, they have programs for you in the work setting that can help with your mental health. So please take advantage of this, okay? Yes, these help with stress management, stress reduction. And during these webinars and seminars and whatnot, you're not only obtaining education and know-how, you're actually being more social, right? You're interacting with your coworkers, even if things are occurring virtually. In the work setting, the actual physical work setting, for me, we're actually having virtual meetings and we're actually all in the same building, okay? We're just minimizing our risk of being in contact with each other. So social distancing doesn't necessarily mean social isolating from yourself. So you can still communicate with each other, virtually, all right? The second thing is actually when you're at work or at home, keep your workplace surroundings in your actual workspace decluttered, organized, and clean. All right. And this will actually serve two purposes. Okay. The first purpose is definitely it will help calm your mind. I mean, really, when you think about it, like, what do you feel when you walk to your workspace and you got papers thrown here and there, everything's all messed up, trash, things are just scattered around. I know for me, that's one of the things I always talk about. I just feel that extra anxiety. I feel like I can't think. My mind is just not there. All right. And think about if you come to your workspace, wherever you are, papers are in order, your files are in order, stuff isn't just, everywhere. You have that sense of calm, right? You feel that sense of calm and yeah, okay, I can get started. All right. You don't feel so scattered. The second reason for decluttering your workspace is actually, especially in this time of COVID, it's more easy for you to clean it off. right? You don't have to shuffle a bunch of stuff just to clean off things, okay? So you'll need to daily wipe off your workplace area, paying attention to the handles, doorknobs, high-use things. So having a decluttered workspace calms your mind, and it actually permits you to easily clean it up when you have to, when you get to work, when you leave, or anytime during the middle of the day. The third thing to help you manage your overall mental health when you're at work during this COVID is actually doing some deep breathing, some meditation, actual relaxation techniques at your desk or in your personal workspace. And if you think about it, typically when a person is stressed out, anxious, or even depressed, depression is definitely in the workspace. Those muscles are just tight, right? You might have some neck pain, some back pain. And then if you're in a workplace setting where you're sitting at a desk, things are just extra tight. You're hunching down on your computer, and you just feel that extra tension everywhere in your body. And so if you can incorporate some relaxation techniques, deep breathing, actual stretches, shoot, you can even color in your workspace on a break time, right? You get that?
Those coloring books, Dr. Deitrick has coloring books, adult coloring books.
Yeah. So you can even do some of those relaxation techniques while you're at work to help calm things down, right? The next thing that is very, very important is to protect yourself. Okay. And what I mean by that is if you aren't, this is not necessarily for the people at home necessarily, but if you're not physically working in an office where you can shut your door and be by yourself, I would definitely recommend you wearing your mask, especially if you have to maneuver throughout the office. Okay. And of course, wash your hands when you go to the restroom. If you know and find out that you're using high use areas or objects like doorknobs, handles, the telephone, especially other people are using it, high use areas, you definitely need to continually wash your hands throughout the day. Use a nice moisturizer in your hand when you're done. Okay. And if you're working at home, even in your own environment, make sure those who are entering your home are going to take the necessary precautions to not spread anything into your home, because your home is your haven. It's supposed to be safe, not only safe, but calm and, hopefully free of COVID if it can be. Okay. You just don't want to add to it. Okay. So just make sure that that's the issue. Okay. And then another thing to help you manage your overall mental health is just imagine and understand that you're dealing with all different personality types in a workplace setting if you're physically somewhere else. And people have their different personalities. They respond to stress and anxiety in a different way. So it's very important to keep those lines of communication open with each other, okay? If you're feeling stressed or if you're starting to get an attitude, okay, not now, I can't talk to you right now. Go off into your corner and do some deep breathing. Don't turn on each other in these times of high stress already. Okay. Don't be so snappish. Don't be so quick to judge other people, their statements that they make. Find out what they're talking about before you rush to action. Communicate with your coworkers, communicate with your boss. Just try and keep it as calm as possible, because all that extra stuff really isn't necessary and it's not helping nothing. All right. The final thing is if you're at home, this is for the at home workers. If you're at home, set your boundaries. Okay. When you're working at home, work at home and be done. Don't carry it into the home environment. Even if you have to create a separate little workspace where you know that you can physically remove yourself when you're done working. All right. So this will help you keep things calm in the work setting, help improve your mental health, and just above all, be nice to each other. Seek that additional help if you feel that you need it. All right. So now, if things aren't really working out for you at home or at work, and you feel that you can't mentally function, this could mean that you are working yourself up into a crisis. And this is where Dr. Kadisha, our board certified emergency medicine doctor, she's going to take over right now and try and help you get through those times where you are in a crisis. All right. So Dr. Kadisha, take it on over. Take it on in.
Do we have any comments or questions?
Yeah.
So, so we have a lot of comments. Thanks, Dr. Carol. So, Victoria, who loves Dr. Carol's morning meditation, says that since her trigger to stress is the news, She doesn't turn on the TV in the morning. She does Dr. Carol's morning meditation. She listens to music, specifically jazz, gospel, and R&B. And she says when she comes home, she has taken up baking as a form of relaxation in addition to painting her house. Dr. Carla Court emphasized deep breathing to relax. And let's see, I think she also emphasized the decluttering. She loved that. And Dr. Kelly Wood joined us as well. Frederick Todd joined us. Hello to everybody. Thank you so much for coming in. If you have any questions or comments, other comments, we love the comments. And since I'm doing the last portion, especially if you have questions, do put those in the chat.
Yes.
Excellent.
All right.
So great though too. They got it.
Yes. Oh, good.
All right, guys. So what if it's not working at work and it's not working at home, and you feel like, things are starting to become overwhelming? What do? You take it to the next step. So before, I know a lot of people are afraid of coming to the emergency department, and luckily that might not be where you need to go anyway. So the first thing I would recommend is to call your physician, call your primary, whoever's prescribing any mental health medication, or even if they're not, if you have a primary care physician and a psychiatrist or a therapist, call them first, because they may be able to assist you so that you can still avoid the ER. Just like Dr. Ken, he does telemedicine all day. He's a psychiatrist. He helps people all day from home, and he helps keep people out of the ER, which I definitely appreciate. Hi, Amy. Welcome. So she says she's taking up eating as a form of
we're gonna talk about that one.
Don't get me started. Okay, so what I'm seeing is that a lot of people are anxious about coming to the ER, or their anxiety is so much that they come to the ER at all times of the day or night. I work 24-hour shifts, and sometimes in the middle of the night, people's anxiety drives them to my freestanding ER. So I work in an ER that is not attached to a hospital. I'm in Texas. We have tons of them here in Houston. And a lot of people will come in saying, I came here because I don't want to go to the hospital. I don't want to catch the coronavirus in that waiting room. I had a patient who fell over a cone at Chase Bank. She was 67 years old. And she said, when they called the paramedics, Chase called the paramedics, she said, get away from me. Don't get too close. I don't want the coronavirus. And they're like, oh, we can transport you to the hospital. She says, I'm not getting in that ambulance and possibly catching the coronavirus. And I told her, ma'am, medical professionals, we all take special precautions so that we don't get ill or catch it, and so that you don't catch it. But you know what she said? It's back to the news, like what Dr. Carol said. She goes, yeah, but in the news, they're saying that all of y'all, that all the paramedics have it. And that's not true. That's not true. And I do a kind of a telemedicine with the city of Houston's paramedics, and we get to see each other. We do FaceTime, and all of them have masks. All of them have gloves. They don't want to get it themselves. They don't want to pass it on to other patients. Just like Dr. Ken says, we're all doing our part. And welcome to Dr. Mashika, Dr. Bunyan. Okay, so I just want to put you all at ease about what the hospital does, what your primary care physician's office might do, what freestanding ERs might do, and what urgent cares might do to help put you at ease, help put everyone at ease, and stop or prevent spread of COVID-19. So just really quick, I'll try to be quick. So the first thing you can do is, like I said, call beforehand. You might not even have to go anyway. They may be able to fill your scripts over the phone so that you don't have to go to the ER. The CDC has also, and say if you do need to go and be seen, the CDC has given medical staff a script of things to ask you from the greeting on down, as for things to help determine what entrance you might have to go to. A lot of facilities have separate entrances.
Yep.
So that's very, very, so you might want to refresh. So if the feed is slow, you might want to refresh your screen. Okay, so calling is one thing. The CDC has scripts. They ask you about the fever, cough, shortness of breath. They ask you about the 6 new symptoms, the chills, repeated chills with shakes, muscle aches, headaches, loss of smell or taste, sore throat. They know about that stuff. The staff is kept abreast of the new developments with this pandemic. Okay. Oh, great, Dr. Zakia. So the feed is fine now. If you have underlying medical conditions, they want to know that, because those things, as we know, can complicate an illness. So, chronic lung disease like emphysema, asthma, heart disease, CHF, complicated diabetes. They will ask you all of those things and more to see if you are a patient, especially if you have COVID symptoms or something like that, to see if you even need to get in a car. Because if you are severely ill enough, they might tell you to call 911. Have you noticed when you call your physician's offices, any specialty, after hours, they say if you're having a medical emergency, call 911. Mm-hmm. So you might not, it could be that you shouldn't even get in a car. The second thing is PPE, AKA personal protective equipment. They have that for us. We've got bonnets, goggles, masks, gowns, all of that. And then we have masks for you. And when you come to the facilities, there usually is someone there to ask you, say, if you don't call ahead of time, do you have these symptoms? And if you have these symptoms, they give you a mask. But even now, with asymptomatic transmission of the virus, they might give you a mask anyway. Exactly. That's what could be happening now. Okay, and so again, the staff is kept abreast. The facilities have relationships with the local and state health departments that they never had before, because we often are sending the samples of the COVID testing to those departments. And I'll tell you this, though, unless your facility tells you to, don't go there expecting to just get tested just because. Check with your city health department and see where the free testing centers are, where you can just get tested just because. Don't overwhelm Dr. Carroll's office or Dr. Deitrick's office or my ER for test just because. Okay, so when you get there, again, separate entrances may be available for people with COVID symptoms. And there might be designated areas where those people are examined. So if you don't have COVID symptoms and you're just trying to get seen for something completely unrelated, know that your facility might have the COVID concerning people on, like, in another building or under a tent somewhere outside being examined separately. And, we have no-touch methods for disposal of waste. There are new cleaning protocols that are appropriate for COVID-19. We clean, sanitize, and disinfect. Just like Dr. Deitrick said a couple weeks ago, there's a difference between those 3 things. And we've stopped elective surgeries, so there are way fewer people in the hospital. They limit the number of visitors. At my place, if people are kind enough to bring their spouse or coworker to our facility, they are rewarded with someone saying, now go sit in your car outside. You can't even sit in the lobby. Only the patient can come back. Unless it's a child, only the patient themselves goes back and the other people sit outside. Okay, another thing is we've got hand sanitizer dispensers. They're right at the doorways to the exam rooms. Some hospitals are even adding sanitizer dispensers to the patient bed area, like by the headboard, so that we can sanitize our hands before we even take a step away towards the sink, because some people might examine you and on their way to the sink, do this or something. They've got sanitizer right by the bed now to help keep us from spreading the virus. And they're also bumping up the ventilation rates in many places to bring in more fresh air from outside, so that the amount of virus in the air, if there is any, there might not be any virus in the air. There might not be any. They just want to make sure that there's less, that it's diluted if it is indeed present. So I just wanted to, let you know of the things that hospitals and doctors' offices are doing. Don't think that, I'm going to go and I'm going to catch it. No, they are doing things 24 hours a day to make sure that the staff doesn't get it and so that you don't get it. So once you get there, you're in your crisis. I think the pandemic is bringing out mental illness in people that might have gone dormant before. This is a stressful time. So some people may be experiencing their first episodes of acute mental illness during this time. So when you go in there, and not much has changed, you go in, you're seen by the triage nurse. I examine you, and we have to get blood work. We have to get blood work and urine to make sure that there is no physical reason for any change in symptoms that might look like mental illness, but it's really something else. So you'll have to get blood drawn. We'll have to get urine. It's going to be a blood screen.
Yes.
It's an alcohol level.
Don't be offended. It's just how it is.
Right. It's everybody. It's everybody. It's everybody. And if you drank too much, the longer it is, you're going to have to wait. You're going to have to wait until your alcohol level is below a certain level. And psychiatrists in the chat, Dr. Erica, Dr. Ken, is it 0? I think, does the alcohol level have to be 0 or just under 100? Those two figures ring in my mind. So you might have to sit there and wait while we wait for your alcohol level to go down. And if you are a heavy alcoholic, the more that you drink, the higher tolerance you have. Your level should go down about 25 points per hour. So if your alcohol level is 100 and the psychiatrist wanted it to be 0, that means you're sitting in there for 4 hours. Yeah. And because of the COVID precautions, your family might have to sit outside and you have to sit in there alone. So don't do that. Let's see what else. So, and if you're having acute episodes that are related to mental illness, you will be given medication. It could be anti-anxiety if we can't get you to calm down. Okay, so Dr. Ken is saying alcohol level less than 200. Thank you. So if you're out, and we've seen people with alcohol levels of 300. So yeah, so you might have to wait 4 hours just to get it under 200. Thank you so much, Dr. Ken. So medication will be given if we can't get you to calm down. Sometimes we can get you to calm down with deep breathing, with reassurance, a darkened room, things like that. We do try. We don't just throw meds at you immediately. But, it's the ER. We don't have that much time. We don't have an hour to sit there and breathe with you. So we might have to give you anti-anxiety medication if you're acting as if you are a threat to yourself or others, and you look like you're going to be an effective threat to yourself or others, then you may have to get other kinds of medications that will make you go to sleep. Mm. And then usually people, when they wake up, they're so much better, and they're apologizing for whatever it was they did. And again, if you need prescriptions, just to avoid even being in that environment, don't wait till you're down to like 2 pills or 3 pills. My primary care physician's office says 3 days worth of medication. Mm-hmm. But I'm saying for this time during the pandemic, I would say give it 5 days, have 5 days or a week's worth of medications, and then start trying to call in for the refills because the mm-hmm. lines might be jammed. There's fewer staff working in these offices, so you might not get in he might not get on the line with anybody in a timely fashion. So, yeah, keep up with your meds. As Dr. Deitrick said, call to refill when you have more than just a few left. And that is all I have. Hopefully that will help you all be at ease with going to the hospital and getting the care that you need, and will help you know what to expect should you or a family member, and I know a family whose son had an acute psychotic break last week, and they're all quarantined in the house, and the family was hoping that whatever it was would wear off. He was known to smoke marijuana, but he was acting differently than he typically does. And if you have someone in the house who is acting like they might be a threat to themselves or others, I would say don't go to sleep with that person in that state. Call for an ambulance. Don't be surprised if they call the police. Just be, especially if it's, someone who's strong, just, watch the police, tell them, hey, this is my son, just keep an eye on them. But sometimes that might happen. Don't be surprised. It's typical. And especially if that person is reluctant to go to the ER, but they are acting in a bizarre fashion. And they might end up staying in there for about 3 days for evaluation at least. And that's all I wanted to add. So do we have any questions or comments? Does anyone, let's see, are we able to take calls or someone to come in? You can, let's see, we'll just wait and see if folks have questions or anything. And I'll type in the chat any questions or comments. And Dr. Carol, Dr. Deitrick, do you guys have anything to add?
Yeah, well, one of the things I want to thank everyone who's taken time out of their busy schedules to join in. I hope you've heard something tonight that can help you at home, in the workplace, or if you need to use emergency services related to mental illness issues, that Dr. Kadisha's information has been helpful to you, because that's what we do here at Perspectives in Primary Care. We get together and we try to bring you evidence-based information that's going to support you personally, professionally, in your community. We all have best-selling books. My book, Meditation in a Time of Madness, a guidebook for talented teens, tweens, their parents and guardians who need to thrive. Really, this whole space with mental health, that's my jam. I think that's so, so, so important. And as Victoria mentioned, she is one of the people who meditate with me every morning. So every morning on Facebook over at Dr. Carol Penn, DrCarolPenn, and it'll pop up, Movement is My Medicine. That's my Facebook page. You can meditate with me, and we meditate, and I call it Getting Your Mind Right. It's a guided meditation. It's at 6:45 a.m. Eastern Time. Why? Meditating in the morning is one of the best times that you can meditate, because it allows you to fully reset. So those anxieties, those worries, those top 5 worries that I mentioned at the top of the show, if any of those things are weighing you down, they're on your shoulders, it allows you to release that and say, it's a new day. I'm going to walk forward. I'm going to reset my mindset. So I want everyone to join me for meditation. If that's too early for you, well, #replay. You can find it throughout the day, whenever you get up. So important. And also what it does over time, meditation actually physiologically changes the structure of your brain for the better. And so that's the long term and the immediate. It's going to help eliminate or alleviate some mental fog, and certainly helps you manage and alleviate stress. Dr. Deitrick, how can people get in touch with you?
Oh, well, I just wanted to say, also those who are listening, I also started a watch party on my page. So thank y'all very much for taking the time this evening to chime in with us three. Those of you all who are listening, we would really appreciate if you all could put something in the chat, even if you're watching this on replay. One thing that you may have taken away from this live stream tonight that has benefited you, or you can share and it can help benefit someone else. And those of you who are in the work situation, um, or in the home work situation, it's just very important for you to, of course, not only do your work, but to find those moments, find those times, find those modalities that you can learn how to relax. And it's obviously a very stressful time that we're in. I just wanted to share that for you all. And those of you who actually are not working, in any capacity, those who have been laid off or in furlough, I know this is especially a stressful time. You got the finances coming in there as well, and it's just my hopes and prayers that you'll get back to work soon, and you still try and find some coping ways that are positive, not detrimental to your health, or negative ways to help relieve some of that stress and anxiety that you all are feeling. And so, like Dr. Carol had mentioned, I too am an author. I actually have two best-selling pieces of work. I have my Relaxed and Ready. It's actually called A Simple Roadmap to Reducing Workplace Stress and Frustration. And here, this actually teaches you ways that you can actually learn how to relax in the workplace setting. Actually, you can evaluate what causes you stress at work. And so this is a great read for you all to pick up. And then also, I just recently released my adult coloring book, Relaxed and Ready, an inspirational coloring book to calm your mind. And in here, I have actually inspirational quotes from thought leaders that you may or may not heard of. Also, inspirational quotes by me. And it's just some fun coloring, you know, where you could just take the time, create something beautiful in your home or work setting if you're on a break. It's very relaxing. It just focus your attention on creating something beautiful. So I hope you all will take the time to check that out. You can look at relaxedandreadybook.com or relaxedandreadycoloringbook.com. But to find out more, you can find me at drdeitrickg.com. That's DRDEITRICKG.com. Thank y'all very much for tuning in. And Dr. Kadisha, is there anything else?
And yeah, I have a book also.
Yeah.
It's Help Us Help You in the Emergency Room. This book was inspired by 20 years of complaints, concerns, and questions that people have asked me once they realize that I'm an emergency medicine physician. So this book is inspired by people like you. So it's not coming from some, stuffy, dry doctor's mind. It's advice, it's answers to questions that people have asked me along the way. And I break it up into sections, easy sections. There's tons of pictures in here so that you can possibly go to the section that you're interested in. You don't have to read it cover to cover. There's what to do or what to know before you go to the ER, things you could do tonight or tomorrow on the way to or from work, or just walking around, like knowing where the proper entrance is to your ER, or knowing where the best parking is for your emergency department. Dr. Ken says, meditate, color. If all else fails, take the mask from the mobile MD kit. Right. If you start hyperventilating or something, use the mask to slow down your breathing. Also, there's information on what to do once you realize you need the ER, what to expect on arrival, why the nurse asks you questions and the doctor asks you the same questions, and why didn't we go in your records and look it up before we asked you the same questions we asked you 2 months ago. We can't do it. Okay. And there's like tons of pictures, things broken up into sections. And there's even a little workbook area for like your physician contact information. There, people are always struggling, and I have to wait for you to look up your doctor's number. There's little blanks and stuff for your conditions, your meds, your allergies, when you had procedures, when the last procedure was, what the results were. So you can start working on this, on being emergency ready right away. And I know, everyone's dreading going to the ER right now. This book will help prepare you by helping you avoid unnecessary charges, delays, frustration, misunderstandings, miscommunication, and all the above if you just get this book and look, just page through it. So you can reach me or follow me on Instagram at dr_Kadisha_MD. Let's see. Dr. Ken says folks need to feel like they are understood when they meet a doctor, especially now. And that's a great point, Dr. Ken. My book also tells you how to explain your symptoms. I share a little secret that we learned in medical school. I bet I didn't mention it to Dr. Carol or Dr. Deitrick, but they probably know the mnemonic old car. Have you heard of old car?
I have not.
So old is onset, location, duration. Car is character. Okay. See, they're nodding. Alleviating factors or relieving. Let's see, what's it? Associated factors, relieving factors, and exacerbators. It's really old care. If you can just think of that, if you get my book, you'll see that and more, and you'll see why we do certain things that make us seem rude, but I will explain why those things happen in the book. So Instagram, Dr. Kadisha MD with the underscores. You're here on Facebook, Dr. Kadisha MD. Let's see, and Twitter, same thing, and my website where I have 8 freebies, or a freebie, which is 8 essentials to surviving a medical emergency at www.drkadishamd.com. And what are the 7 dimensions? What are you talking about, Dr. Ken? 7 dimensions. Do you want to come and say anything during the discussion, or what are 7 dimensions? Do you guys know what the 7 dimensions are, or is it what I'm talking about, the old care?
I think it may be the old care.
Okay.
All right. Well, and getting ready to wrap up, we've covered, but I'd like to bring it back home, because one of the things before COVID-19, if you're in primary care, you can expect that every 1 in 5 patients that you see has a mental illness disorder, diagnosed or undiagnosed. So that's 25% of your population. Mm-hmm. And if you're a medical professional watching this show, it's really important that you begin to understand the full spectrum of humanity, what's going to be coming in, and that's going to be coming in. It's mind, body, and spirit, and we are being called upon to recognize and treat across the full experience of what it means to be human. And now that we've got this pandemic to deal with, and we've got a crisis of fear, a pandemic of fear that's out there in the public. It's certainly within the helping and serving professions themselves. So we want to be educated to this. We want to be informed about this. If you're having difficulty, we want you to reach out for help. Reach out for help. But in signing off, I'd like Dr. Kadisha and Dr. Deitrick, what are your 2 top helps? Share with the people that are watching, what do you do? The top 2 things you do to maintain your mental health, to be at your best mentally. What do you do? Your top 2 things, because that could help someone else understand what we're talking about and grasp onto something that could help them mentally and help their mental health.
So for me, I always talk about it. Probably the number 1 and number 2 thing for me is to deep breathe. Anytime I find myself hyping myself up, getting upset, even getting angry, I sit down and I actually do some deep breathing until I can calm it down. And all the better, what I can do is put on some nice, I love instrumental jazz music. I mean, I don't like it. I love it. So those two things, if I could just sit there, close my eyes a couple of minutes, just take some deep breathing and calm myself down. I mean, for me, that's totally golden. Okay. When I do have time, I'm not just promoting my coloring book, but I do. I love to color. It just really puts me in a special place where I feel happy and creative. And so I do those things. That's definitely what I do.
Excellent. Excellent. Dr. Kadisha, what are your top 2 or 3?
My top 2 or 3 are, let's see, one is humor. I love to laugh. Being in the ER, we probably laugh at things that we shouldn't laugh at, but I can see the humor in almost any situation. Another thing is exercise, like cardio. Just even if it's just taking a walk around the block or to the nearest park or something like that. Of course, now you might need to, wear a mask just to do that. But just getting out, enjoying the sunshine. Sometimes just looking out the window at the sun helps me. So laughter, sunshine, exercise.
Excellent. Nice.
Very good. And for me, it's movement. I love to just put on some music and dance. Yes, that is something that just, disrupts stress for me. Meditation, you've heard me talk about it earlier. I have been meditating since I was in high school. So again, but meditation could be a lot of things. It's really put yourself in a state of relaxed moment to moment awareness. Yes. So those things that make you go,
yes.
So yes, I do several different types of meditation. I love just freestyle dancing and moving. And I love spending quiet. I'm blessed to have a partner and a husband. I love spending quiet time with my husband and just sitting quietly with him, offering gratitude or saying grace over a meal. I find that just really disrupts any sense of anxiety or stress that might have been building up for me during the day.
Oh, I love it. I love it. Yes. Yeah. I just want to say one more thing too, Dr. Kadisha, taking from you. Laughter is just its own medicine right there. I mean, for so many different things, you're right. If you could try and find something funny about a situation, even if it's like laughing at yourself that you're doing something, I mean, it really helps so much. So I agree with you. I'm sorry, Dr. Carol, I got to add on one more because, I love laughing as well.
Yes, laughter is good medicine. And really, all the things that we're sharing tonight, these are good medicine. If you have these things in your toolkit, and I'm sure you all have something in your toolkit, if you stop and give it some thought, your mental health is as important as your physical health, your spiritual health. And we are talking mind, body, and spirit. You put all that together, and not only are you going to get through these uncertain times, but you're going to find that you can thrive in these times.
Well said.
All right. So I think we got to say goodnight and let people go to bed.
There's still 12 people in here.
Thanks for hanging in.
Thank you so much, everybody, for coming in despite the technical difficulty. And it went up to 14 from 12. Thank you so much, everybody. Please go into the comments and, let us know other things that you might want us to discuss, just in case you're like overdosed on COVID. Yes, we love
other things too.
Laugh.
Absolutely.
Deitrick's laugh. So, so that is up to 15. So yeah, we love that you guys came in. Thank you so much. It just makes us want to keep going, but we do have to go to work tomorrow. Please go off in the comments. Go off in the comments and let us know what you want to hear about possibly next week. So from Perspectives in Primary Care, it's Dr. Kadisha with Dr. Deitrick and Dr. Carol. And we wish you guys a good night, sleep well, and we'll see you next week.
Yes. Bye. Good night.
Good night.
Good night.